Hello everyone, my name is Shalom from MediPanacea Rwanda. I'm here to talk about pharmacy and medicine. During COVID-19, developing countries, including Rwanda, faced the challenge of not receiving vaccines on time. Developed countries like United States of America and other countries from Europe received the vaccine very early and started to fight with COVID-19 very early. And it helped them to reduce the number of deaths, and it helped them actually to look good in the face of all people around the world. Africans were still struggling to actually import vaccines that can help the citizens in Africa. That happened, yet every year almost 9,000 of graduates are graduating from health faculties or health schools only in Rwanda. Imagine the number of health students who are graduating around Africa. And among all people graduating from health faculties in Rwanda, 5% are from pharmacy. None of them is qualified to be producing a vaccine or a drug. Currently in Rwanda, we have only 12 technicians in pharmacy who can actually work in developing industries like biotech and Labofar, if it is still working, and other industries that are yet to be born in Rwanda. Only 12 technicians. Imagine, we are having 14 million of Rwandans now. So the ratio is above 1,600 people on one pharmacist. It's a very big problem. And also, we still have the low number of people who understand what pharmacy is. Most of them, for example, 212 students who graduated in pharmacy last year, I assume that most of them are going to be working as retailers in the working pharmacies in the villages. And that is not what we should be doing as young visionaries in Rwanda. That is how actually MediPanacea Rwanda came out. We saw that problem, and as you understand, it is a very big problem. We don't want to see our kids still struggling to find paracetamols in pharmacies only because the price is high due to the low rate of imports. Now, 95% of medicine that is used in Rwanda is imported, is bought abroad. That is what we don't want. We want to reduce the importing at least from 95% this now to 40% in 40 years. Understand us very well. We have a vision of 40 years. We believe that it is not easy for us to be solving that problem. Even government tried for 30 years, but still now it is still a problem. We understand that we can be the source to that problem. We can be the solution. That is how we really aim to train scientists, to train pharmacists, and equip them to the skills that can help them to be able to train to produce vaccines or drugs in Rwanda. We also understand that it is not easy. We know that the journey of people who were able to be out as 12 only producers in Rwanda is still having thorns. We know that only what you can do is starting small and believing in the process, trusting the process. Here is how we plan to do that. We are planning to make this platform for you, particularly for the pharmacy students who can just come and learn with us. We will be having some teachers who will train you. If you get interested and decide to be one of the member of our cohorts, we will be planning to take you to the laboratories and we train you so that we can have the large number of producers who can be the future of Rwanda. We are very sad, we're not happy. We only have 12 people who can at least be hired by the developing industries in Rwanda. I mean, Rwanda is developing the pharmacy industries which can be producing medicines and vaccines. But only 12 people can be trusted to be hired in those industries. That's very sad. Imagine, last year 212 students graduated from pharmacy, and none of them is qualified to be working in industry. They are all believing to work in the pharmacy shops, detailing medicines. They are like business people. That is not what we want. We believe that Rwandans are very able to be developing medicine, to work in industries, to create their own industries, having that trust in themselves and bring something to life. That is our belief. And from God and from our efforts, we believe that this is going to work. What we want you to do for us, we believe that when you follow us to our channels and when you come and study with us, it is going to be helpful. You will learn much from us, and we will be a family. We will be not a family which is going to just celebrate and eat together, but the family which is having the same purpose of breeding Rwanda's pharmaceutical industry. Thank you for believing in us, and we hope to see you every week in our teachings that we are going to be posting on our social medias. Thank you very much.